Thank you so much for joining us today. Our session will be recorded. You will have notification on your screen asking if you consent to the recording. Thank you. Comagine Health, our mission together with our partners is to work to improve health and create a better healthcare system so that people and communities will flourish. Our opioid work, we seek to promote safe prescribing practices, decrease opioid use, and behavioral health outcomes. You can find us specifically with this project at the Comagine 6 Building Blocks website listed here. Today, we're talking about improving patient engagement through motivational interviewing. My name is Maria Clemensrud. I'm a Senior Improvement Advisor with Comagine Health. I'm also a licensed mental health counselor. This project is made possible through the Washington State Department of Health and the CDC funds for opioid data to action. Our short Quickinar today, which will be about 15 minutes, is designed to help discover why motivational interviewing skills improve patient engagement for persons who struggle with substance abuse and addiction, to learn how to integrate the principles of motivational interviewing into your site, into a busy office, and to study or have a refresher of the 5-step MI process and techniques that you can practice within your clinic at any time and introduce into your workflow. So what is motivational interviewing? It's really a method or a technique of interacting with patients. It's aimed at exploring reasons for ambivalence and changing attitudes and behavior. It's collaborative, person-centered, with a specific objective. Motivational interviewing is an evidence-based technique that helps patients consider and promote their own insight about what they would like to change. The core goals of MI are to express empathy and elicit reasons for and commitment to changing behaviors. And specifically in this webinar, we're talking about substance abuse and other unhealthy behaviors and or addictions. So the foundation or the backbone of motivational interviewing is really around empathy. And this is achieved by listening. And that is a learned skill. The development of discrepancies between the client's values and their behaviors, which the interviewer can ask for clarification and can help point out those discrepancies. Rolling with the client's resistance with reflection versus confrontation. So really, you are, if you will, a referee between the patient's current state and their best self or their desired self. So you're rolling with their resistance and observing what that might be between the patient's current situation and what you're hearing what they may want to move towards at some point. You're supporting the client's self-efficacy regarding the confidence to make behavior changes. So you're affirming, you're positive, you're reflecting goodwill to your patient. So why are MI skills especially helpful for people suffering from substance abuse and addiction? From Desmond Tutu, there comes a point where we need to just stop pulling people out of the river. We need to go upstream and find out why they're falling in. To get to the core or the heart of addiction and or substance abuse, a person needs to be valued and validated and not shamed or judged. And we know the stigma associated with substance abuse has begun to shift, but is still definitely in play when a person comes into an office and may be apprehensive about sharing a problem that they have. this is why MI skills are in high demand in healthcare today. We know that stigma towards substance abuse and addiction involves isolation and disenfranchisement, especially now, coming out of or still in a pandemic. It is very important to present unconditional positive regard to a patient that may be feeling shamed or judged, unforgivable, unforgiven, unworthy, and really not knowing where recovery might begin for them. So how do you integrate use of motivational interviewing skills into a busy clinic? Do you have to have an advanced degree or attend a long training to learn these skills? No. It really is an attitude or an approach, and then techniques and mechanics around how to work with patients, how to talk with patients, so that you're projecting what we talked about a few slides back: empathy, self-efficacy, discrepancies between who they are and the behaviors that they're maybe relying on currently and those that they want to move towards to become healthier. So it is possible to integrate motivational interviewing skills into a busy clinic, but it needs to be intentional, needs to be repetitive, and embraced by the entire clinic, but can begin as a pilot with champions of motivational interviewing. From a quality improvement approach, you can form a motivational interviewing team, set time aside to meet, discuss the principles and techniques of motivational interviewing. You can put these up in a break room. I strongly recommend you challenge staff to practice these skills with each other, to post the values of motivational interviewing, and to get really good at using these skills within their internal team, so that when they walk into a patient room, they know what the techniques are. You can ask the team to write a PDSA around motivational interviewing, introducing it into the workflow, and practice the skills as a team. So now a refresher for some, a reminder for some, or new skills for those that have not learned motivational interviewing in the past. What are the 5 steps? The first step when you are interacting with a patient is to ask open-ended questions. This would be a question that does not demand a yes or no answer. It's a, what do you think? Tell me about. How did this develop? It's a curiosity. It's being open to listening after you ask the question, instead of do you understand, do you agree, where the patient may feel their only answer would be a yes or no. The reason that open-ended questions have a lot of strength behind them is you are wanting the patient to explore within their own mind their ambivalence. Perhaps no one has ever asked them these questions, and in asking the question, you're saying that you are going to be silent and listen to their answer. Second, reflect and respond. A simple reflection would be directly repeating what the person said. A complex reflection would be repeating what you think the person means. So perhaps you're meeting with a patient who has said, I know I need to stop drinking, but I'm afraid. When you've asked, I noticed on your screening that you're having 3 to 5 drinks a day. Tell me your thoughts about this. And the patient responds, I know I need to stop drinking, but I'm afraid. The simple reflection is, I understand you're afraid. The complex reflection is, you have your health and best interest in mind, but you feel worried how to start. Complex reflection involves a little bit more unpacking of what the patient has said, and I would recommend you start with the simple reflection unless you feel confident to move forward with the complex reflection. You affirm their strengths, and for many, the action that's happening in this conversation is they're saying the words they've thought a million times before that they haven't said out loud. So to have the conversation is pretty huge for a lot of patients. You want to project that sense of empathy and unconditional positive regard by affirming the strengths. It's great that you're starting to think about making a change. You want to validate the concerns. Your health is important to you. Being proactive with your health and learning about a change process is important to you. And then you do some summarizing. You ask what information the client may know about the process. You share information on support to help with something like drinking or nicotine cessation, and then you verify what they have understood and what they will do with the information. This is the point where you want to just reflect back what the patient has shared and not present more concerns that the patient may not have expressed. That would be or could be overwhelming to the patient. And it could also give them the feeling that you have an agenda for them and you may not be listening to what they've said. A note about client resistance. A therapist encountering resistance from a client is much the same as a person in a canoe being swept along on white water. Just as a canoeist probably would not choose to turn around to paddle upstream against the current, so the motivational interviewer will not argue with the client, but will respond using that energy to steer the interaction. And I think it's pretty common in a primary care setting that a patient may become afraid or feel defensive, and that would be when you may encounter resistance. So as you're going through this process, if you do encounter resistance or defensiveness, then the use of silence or a response of empathy, I can tell you might say something like, you took a really big step today sharing this with me, and I can sense that it might be a little overwhelming. It would be overwhelming for me. I just want you to know I'm here to listen to you, and just having the conversation today perhaps is enough for us. What do you think? Asking the patient. So then you do try to determine an action. If the patient is contemplative, it means that they're ready for action beyond just talking about what their wishes are. What would you like to do? If they're pre-contemplative, it means that saying the words, having the conversation today may be all they're ready to do. They're not yet ready for a more tangible action, but the door needs to be open because the seeds have been planted today. You could say, please let me know if you want to talk further. I'm always available to continue the discussion. So if you think that you'd like to have a conversation about motivational interviewing skills, to have a practice facilitator assist you in some way to learn these skills, or to integrate these into your quality improvement process, we would love to hear from you. You can contact us at 6bb@comagine.org, and we would connect you with a practice facilitator to work with you on this process. I want to thank you all so much for your time today. We are grateful that you spent it with us, and we'll be meeting again next month, where we will be talking about stigma. Please be watching for that promotion coming up. Again, here is the 6 Building Blocks website. If you're interested in contacting us, you can at 6bb@comagine.org. and I appreciate the time that you gave us today. Take care, and we will see you in April.